Hi, my name is Katie Rowinski, and I'm a licensed clinical psychologist and a senior lecturer at the University of Tennessee in Knoxville. I've taught at UT since 2010, and I primarily teach courses about mental illness, such as abnormal psychology and childhood psychopathologies. Frequently, I have students who are curious about what career options are available in the field of psychology. Over the course of a semester, students become fascinated in the case studies we cover in class. From there, they want to learn more about careers in counseling or therapy. Many become passionate about working with patients suffering from mental illnesses, such as anxiety, depression, post-traumatic stress disorder, addiction, schizophrenia, and many others. The career path for undergraduate students majoring in psychology differs from other fields of study, such as medicine, law, or engineering. Students graduating with a degree in psychology have many options available to them, and this can be confusing. In my experience, I've found that many students are underprepared for what comes after graduation. Some students may not have enough professional experience, such as research experience, clinical experience, or community involvement. When students graduate, they may not know where to go next, what kind of graduate program to apply to, or even what kinds of careers they should consider. And in cases where a student has selected a graduate program, the application process can seem overwhelming. This video series will help explain how to navigate these situations. My hope is that in watching these videos, you'll get a better idea for what options you have and what type of graduate program is best for your career goals. You have many options to consider if you are interested in pursuing a career in counseling or therapy. To start, it's helpful to think about the 3 levels of education. Almost everyone is familiar with the 4-year bachelor's degree. This is a general type of training that allows you to pick a major in one particular area, such as psychology. Unfortunately, you can't become a licensed counselor or therapist with only a bachelor's degree. However, there are some jobs where a bachelor's degree allows you to work with patients. These careers include case managers, research assistants, correctional counselors, or child life specialists. A separate video in this series goes into greater detail about these career options. After the bachelor's degree, there are 2 higher level degrees, a master's degree and a doctoral degree. A master's degree typically takes 2 years to complete. A doctoral degree takes about 4 to 6 years to complete. As you can see, the field of psychology has different types of master's and doctoral degrees, and each of these have different areas of specialization. As long as you pick the right kind of program, you can become a counselor or a therapist with either a master's degree or a doctoral degree. However, most states require an additional 1 to 2 years of supervised training after you finish graduate school to become a licensed therapist. A lot of students are surprised to find out that you don't need a master's degree to get accepted into a doctoral program. But doctoral programs are extremely competitive, especially clinical psychology PhD programs. The acceptance rate of these programs can be as low as 5% on average. Of all mental health professionals, about 75% are master's level practitioners. These are social workers, mental health counselors, or marriage and family therapists. Approximately 15% of mental health providers are doctoral level psychologists. When I advise students, I often ask them to think about where they'd like to be in 10 years. What kind of ideal job and ideal job setting could you see yourself in? Once you've imagined that job, you can work backward from there. What type of degree and what specialty will allow you to obtain that dream job? To find these answers, here are some questions to ask yourself. Are you interested in doing research, teaching at the college level, or just doing therapy? Where do you want to work? At a university, in a hospital, in an elementary or secondary school? Would you want to work for the government or a business corporation or a Veterans Affairs hospital? Would you want to have your own private practice? How many years are you willing to commit to graduate school? You might also ask yourself if you're willing to move several times. This is something that is often necessary to complete all the training involved in a doctoral program. Last of all, consider your ideal job schedule or how many hours you would want to work. You should also consider job stability and salary. Before we go any further, I'd like to give you a brief disclaimer. The videos and information on this website are based on my own personal and professional experiences in the field of psychology. Other professionals may have different opinions, and this information may change over time. In your search for the right career path, it may be helpful to ask other professors and professionals in the mental health field for advice. My advice should not replace any data or detailed information provided by individual universities or professional organizations in the mental health field. I feel most qualified to give information about PhD programs in clinical psychology, especially ones that adhere to the scientist-practitioner model. This is the type of training I went through myself. I cannot speak specifically about any one particular program and what those programs value most when considering applicants. My hope is that these videos and this website can give you the necessary information to start exploring careers in the field of psychology and mental health counseling, and ultimately help you find the education and career path that suits you best.